So today we're going to be talking about pain control, and more specifically postoperative pain control. So I'm going to be talking about some of the rationale and theory behind it and what I do specifically for my own patients. Now, postoperative pain control, unfortunately, is an inevitable part of surgery. But if we can minimize it and make the recovery more comfortable, then why not, right? Now, ever since the invention of narcotics, narcotics have really been the mainstay of postoperative pain control across the board, not just plastic surgery, all surgery. And in general, that's the only thing you get prescribed. Now, narcotics are really popular because they work really, really well. The downside is that they come with a lot of side effects. They can cause nausea, they can cause vomiting, they can cause constipation, addiction, and even death. And I'm still not sure exactly why, but here in New England, there is a really bad opioid crisis, and it's really prevalent in this area. So my job as a doctor and as a surgeon is to try to minimize as much as possible how much narcotic my patients take postoperatively. So one of the key points about pain that pertains to the things that I do is that pain is better controlled when you can control it before the pain actually starts. So one of the things I can do as a surgeon is I can make things numb before I cause pain or make an incision or start the surgery. So this actually helps to decrease the overall amount of pain patients have after surgery, as well as they are numb and wake up really without any pain. Now, the second thing that I do is a little bit more complicated, and it involves the pain medication regimen that I prescribe for my patients. So what I have my patients do is actually start 3 non-narcotic pain medications, which are Tylenol, gabapentin, and celecoxib, actually before the surgery. So they start the gabapentin the night before surgery, and then the morning of surgery, before they come, they take all 3. And then what they do is they continue these 3 medications for about 4 days after surgery, regardless of what's going on and how much pain they're having. And if they're having breakthrough pain on top of that, then they can take their narcotics. Now, this has dramatically decreased how much narcotic my patients take after their surgery. And if you can minimize or eliminate narcotic use after surgery, it's definitely a win. Now, while this does decrease significantly how much narcotic my patients take, I still do recommend that they fill the prescription and that they have it at home, because the last thing you want is to all of a sudden have a lot of pain and then no tool to make it any better. Now, what I like about this medication regimen is, although it's a little bit more complicated and it takes a little bit more work, it employs the use of 3 non-narcotic pain medications, which come with a lot less side effects than just using 1 narcotic pain medication alone. So overall, it's a little bit more complicated, but it works a lot better. It's certainly safer, and it decreases significantly how much narcotic my patients use. Now, most surgeons still use the single narcotic pain medication regimen, but ever since I've moved to this method, I've absolutely loved it, and my patients have absolutely loved it, and I have absolutely no regrets about moving towards this more complicated method because it works so well. Okay, well, that's it. Thanks for watching. That's my input on postoperative pain control. I'll see you next time.